dentistry is one of the most important pillars of modern medicine. Starting from simple operations such as tooth extraction or filling to the most complicated and dangerous operations, such as heart operations. Generally, dentistry has three different types. The common need among them is to prevent the patient from feeling pain during the medical procedure. The first type is only a sedation and the patient does not lose consciousness, but the activity of the nervous system in the body decreases to the maximum degree possible with a general loss of sensation. The second type is sedation, in which we prevent the movement of nerve impulses from a certain part of the body to the central nervous system, therefore, only this part loses sensation, and the patient is also completely conscious. The third type is general sedation. The whole body loses sensation and the patient loses consciousness until the doctor finishes his work. All of this is for one reason only: the patient does not feel anything and his body is stable, calm, and completely relaxed, and the doctor sees his work. But here is a question that arises. If general sedation makes us lose all sensation and also lose consciousness, how does it not affect the heart and make it stop beating? And the first organized attempts to carry out the process of sedation throughout history, it was in ancient Egypt and Iraq, then it spread to India, China, and others. Why do we say organized? Because there were much older attempts. It was done through herbs and plants that exist in nature in their raw form, and the most famous example of these plants is the opium. But with the development of the science of sedation and the art of surgery in the Renaissance, the subject has changed, and we can play with the basic materials themselves. The discovery of the ping, you will find it on the channel in general sedation. And to ensure the complete effect, doctors use three different types: mediator or sleeper to achieve the loss of consciousness, and memory mediator to work as a pain reliever, and muscle relaxer to make all muscles not tense in a way that affects the course of the operation. Because if the doctor was working and the body did any unexpected movement, it can cause disasters. In order to understand the effect of these drugs, we need to know first what they work on exactly in the body. Sedation generally works on the central nervous system, and this includes more than one area. One of them is the cerebral cortex, which is the external layer of the brain in which tasks related to memory, perception, attention, and so on are controlled, and it also affects the myocardium, which is the area that controls the transfer of sensory information from the nerve endings to the cerebral cortex. In addition to the spinal cord. Well, what exactly do these drugs affect? When a drug is administered or produced, it immediately leads to the so-called sensory receptacles in the cells. And this is confirmed by the experiment conducted by researcher Richard Lerner, founder of Scripps Research Center in San Diego, California. And it is the experiment that he conducted on the fruit fly under the title of the General Sedation Machine, which was published on March 28, 2020, and the main goal of the experiment was to stop the activity of the neural cells, and used in this process the chloroform substance, which was not used officially at all because of its dangerous side effects on human life. The important thing is that when he put this substance in the body of the fly, he found that it transformed the fat gatherings that were in the cells membrane from regular gatherings to random gatherings, and its content came out of it, which was one of them, an enzyme called PLD2. This enzyme was the reason for the activation of particles in another fat group, such as the potassium iodide channel TRAC1. When this channel was activated, the neural cells were frozen and the ability to move and feel completely stopped. And so anything that happens to the body of the fly will not feel it. When the drug enters the body, it does not work on anything that comes in front of it, becomes an input and knows what it will affect exactly. To understand this point, we first need to know that the muscles in the human body are divided into 3 different types. Each type has a different structure and function. The first type is the skeletal muscles, and this, as its name suggests, is often connected to the bone structure such as the muscles of the shoulders or chest. For example, as for the second type, it is the adhesive muscles, and this usually covers the internal organs, such as the muscles of the digestive system, for example, and finally, the heart muscles, and this is specific to the heart muscle as a whole, and is not found anywhere else in the body. When the drug enters the body, it targets the future of the skeletal muscle cells only, not any other type of the 3 muscles such as the muscles of the limbs, the muscles of the chest, the muscles of the iliopsoas. Therefore, it does not affect the adhesive muscles, not the heart muscles that cover the wall of the heart. And of course, why do we target the muscles of the limbs? Because the patient does not move any sudden movement and the doctor performs surgery. And since the chest is one of the skeletal muscles, that is, its future will be affected by the injection. This leads to an increase in the muscle of the iliopsoas, which makes the patient lose the ability to breathe without help. Therefore, in this case, the patient is placed on an artificial respirator through a breathing tube that injects oxygen to the lung and blocks the urinary tract so that the stools of the stomach do not go to the respiratory tract and block it. And by the way, this is one of the reasons that makes the patient, before any operation, he must be fasting, so that his stomach is not full. The things in it go to the urethra or the lung and cause danger to his life, since the heart muscle is a different type from the rest of the muscles in the body. We understand that it is a muscle that God created in us, so that it works automatically without any intervention. That is, no matter how much you control your body, you can't stop your heart muscle. And the drugs affect the central nervous system. But the trick here is that the heart muscle does not subject to the control of the central nervous system. So no matter how much it is affected, its effect does not reach the heart, continues to beat and pump blood naturally. After we know how the heart is not affected by drugs, there is a question that arises: does this mean that we can never stop the heart muscle if we want to? The answer is that we can. Some medical cases require us to do a surgical operation for the heart muscle itself. And here the muscle cannot be running and pumping blood, and the doctor is running. So the man under our hands, his blood will be drained and he will get a bleeding that causes death. Or you have, for example, heart surgery. If there is a blockage or defect in this case, the doctor uses a machine called the pulmonary heart machine, and regardless of its name, which may seem complicated, but it is simply a technology that temporarily solves the heart and lungs, and through it, we extend the body with oxygen until the doctor finishes the operation he is doing. And after he finishes, he puts everything back in its place and the heart goes back to work.